By the time this episode publishes, my hope and dream for all of you is that you've completed all of your final exams for the semester and you're ready for a well-deserved break. I am going to be publishing several episodes with guest speakers over the holiday break because most of you will not be interested in listening to any dental content that is preparing you for studies for any of your assessments. So I will take this time over the holiday break to provide you with some other professionals, healthcare providers, dental people out in the field that are doing good things that I think will be of value to share with you. So in this episode, I'm going to be talking with Bambi Dixon. Now, special guest for her, she is my sister. And we've had a long history, our entire life, of having conversations about dentistry and medical integration. I chose the path of dental and she chose the path of nursing. And in this episode, we really take a look at some of the real simple ways that we can make meaningful changes to really connect our medical and dental providers. I hope this episode will give you some insight on what a lot of people out there are hoping to achieve over this next 5 to 10 years in healthcare. And you guys are all going to be a really important key part of making this meaningful change to value-based care, to prevention. It's really what is the definition of a dental hygienist. So take a listen. I hope you enjoy it. Enjoy your break. You deserve it. Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I am here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome, so glad to have you. Hey, are you in dental hygiene school or just got your acceptance letter and just started dental hygiene school and you're worried about how you're going to fit it all in, what the evaluations are like, what the key strategies you need to set up in order to be successful? You don't want to have worked all this time to get accepted into dental hygiene school only to make some pretty major errors in your first and second semester. I've put together a course that will really help you set yourself straight right out of the gate and get yourself started on the right foot in dental hygiene school. Whether or not you're just entering school or you've done your prerequisites and you're just well on your way halfway through, this course is designed to help get you straight and keep you straight so that you can become a dental hygienist. Click the link in the show notes and check it out. Well, I feel like we have had so many conversations that we wished we had recorded for this podcast.
Well, yeah, and they're good content because you and I just fight the same fight. We have similar struggles. We don't always see the other side because we're not working in that realm. Though over the last maybe 5 years, that has converged where we can see the value added into talking to the other people like trying to do preventative medicine for our patients. So yeah, I'm happy to be here recording finally.
Yes, so we're finally recording one of our many in-depth conversations about interprofessional collaboration for our patients. So I have Bambi Dixon on the podcast, and she and I have spent, 20, 30 years discussing patient care. It's been a long time.
A lifetime.
And so what I really want, thank you so much for coming on. What I really want to hear about is your experience. Now, I know you and I have talked for years about collaboration, but you recently did your capstone project, and I'd like you to share what your capstone project was about and some of the surprises that you discovered when you were doing your capstone project and some of the ways that you've changed how you practice and how you see patients as a result of that.
Sure. So I've been working in preventative medicine. I was in long-term care, subacute care for years as a nurse before I stepped into a leadership role and really shifted my focus for the remainder of my working years to be more preventative. And the reason for that was I saw so many people coming in with chronic disease management that didn't manage their diseases very well. And the catastrophic events of that, whether it's after a stroke or after losing limbs because their diabetes wasn't managed, cardiovascular disease isn't managed. And then we love those chronic CHF patients that don't manage their medication very well. But overall, their life expectancy was shorter because we weren't focusing on prevention. So about 7 years ago, I stepped into a nursing role in that ambulatory, more preventative medicine while I finished up school. So my capstone project was on how we build a value-based care model in the ambulatory setting that bridges the gap between dental health and medical health. So it's identifying patients that are diabetic and pre-diabetic, because the earlier you detect these issues, the longer the patient has to live with them. And managing diabetes it's difficult because it's lifestyle changes. It's a lot around education. So things that you can do in the dental office will ultimately improve or how their outcomes in their medical realm. So my project was to develop a program where the increased communication between dentists and their primary care provider to increase screenings for patients that are at risk. So at risk can be a family genetic history of diabetes or heart disease, overweight status, their overall health status of their mouth, because patients that have periodontal disease as well as diabetes are at increased risk, like 10 times greater, of developing Alzheimer's or dementia in their end years in life. And that is very costly. It's costly to the patient's families. It's costly to our Medicare and Medicaid programs. So it's a cost-saving initiative that really ultimately will be aimed at hopefully improving dental and diabetes management and care for patients in the community. So it starts with training and building a network of providers that care about this. So I oversee 8 clinics with primary care as the focus, and I surveyed the providers. That's where I started, because you don't know how many of those conversations are happening behind the closed doors with patients, because they're private between the provider. But I bluntly asked them, how often do you screen for a patient's oral health? And 1 out of 16 said, which is scary, but eye-opening, because there's clearly a need. There's a lack of education. And I actually had one provider, God bless him, that said, no, I let the dentist do that. And I said, okay, so here's the statistic. And it breaks down to a law of averages that 10% of our population are diabetic. 36 million people in the country have diabetes. Okay, so that means 1 out of 10 of our patients are diabetic, right? Then of those 1 out of 10 patients, only 42% actually receive preventative dental care. So we're talking even less of the total population. So 4 out of 10 of our diabetic patients actually go to the dentist routinely and get preventative care. So unfortunately, one of our key performance indicators, which is how we're judged in the primary care realm of how well we take care of our patients, is how well do we manage their blood pressure? How well do we manage their diabetes? So that's a direct correlation with how their hemoglobin A1Cs are doing, right? So we have to have a focus of trying to get their A1C levels under 9. And with a patient, we're talking 6 out of 10 aren't going to the dentist, may be having and suffering from advanced periodontal disease. It's that constant state of infection, inflammation in their mouth, which we all know that can have a direct correlation. It increases their sugar levels, it increases their stress on the body. Infection and inflammation or stress on the body. We're never going to get those patients under 9, and we're seeing levels of 12 and 14 that they've switched their diet. We started them on the routine meds, and we still can't get them down anywhere close to 9. But it starts with having the conversation, because your mouth I've always viewed it, and you as too, I'm sure, as it's the opening to the rest of your body. And if
Mhm.
the inflammation and infection is there, it's just a precursor to what's going on in the rest of your body. So I had recommended a screening tool, like questions that we can ask at the primary care level to really determine a patient's risk of periodontal disease. And it starts with, the first question is, can you tell me how your home oral hygiene regimen is? If it's like, oh, I never see a dentist unless I need a filling or it's bothering me, there is no routine cleaning going on. So you know that they're already on a slippery slope. So that's the first one. The other one is really just assessing their diet and how often they see their hygienist for preventative care, because these patients really should be seeing you quarterly, every 90 days, as often as we're seeing them, to assess that A1C level, right?
Yeah,
So
absolutely.
it starts with educating the patients, but even before that, we have to educate the providers on the importance of it and why. But so many, and this is, I think, just a shift of healthcare and how it's gone in the last 20 years that I've witnessed as a nurse. There's the rise of the specialists, right? So we have a cardiologist, we have an endocrinologist, we have a nephrologist, we have all these other specialty doctors that are dealing with individual issues that the patients are having, but there's nobody manning the ship. Nobody's holding on to the steering wheel, really making sure everything's coordinated so that the patient gets the best care that they need. And that's where primary care comes in. Like, we really should be calling the dentist and saying, can you send me their records? I want to see them. And the other way, like, why don't the dentists have access to our information? How come they can't see our recent lab results? Because it's not just the A1C we're focusing on. You're looking at those inflammation markers if we're checking them. You're looking at their white count, because that's going to show infection. You're looking at the whole thing, plus other medications that they're on. Like, people don't think, and I think, and I say, when I say people, I just think the random population, the general population, don't believe that their medications that they take affect their dental health, like
Mhm.
inhalers, or
Blood
their
pressure meds that cause, yeah,
omeprazole, blood pressure, yeah, everything. If you look at the side effect of 99% of medications, it causes dry mouth,
right.
which is in the mouth, like that's it. But people don't see, they don't see the correlation, and we need to do better. We need to educate better. We need to educate the providers, and really bridging that gap is going to be difficult, but it starts with communication and training.
Yeah.
So that was my proposed program. They've done it in some states. I think it was Michigan did it. So they were given a specific amount of money, and the positivity for patients controlling their diet, not just their diabetes and their A1C coming down, but also their oral health has improved. It starts at our legislative level. Like, there has to be people that are passionate about overall health care, because it costs dollars to
Well,
take
and
care of
where,
people if we don't do it. If we just kind of disregard our mouth, and Medicare has done that for a long time, Medicaid as well. And it's difficult to get patients in to see a dentist if they don't have dental coverage, and if they have a state plan. Sometimes their only dental care that they receive in some of my pediatric offices is the fluoride we put on them twice, once a year, twice a year when we see them, which is sad. We need to do better. So.
yeah. I love that you are taking the initiative to have those conversations with the providers and ask those really good questions about what are you doing when you're screening your patients, and how are you handling their oral health needs? Because on our end, on my end, we'll have patients come in and I always feel like there's some information that's missing in the assessment, and it's the information that you guys have, right? So it's all
Right.
about that communication piece. I'll have a patient who will treat their infection in their mouth, and then they're not responding how we expect them to, based on, the trends and the techniques that we use to the standard of care. And then you find out that they're not actually taking their medications the way that they should be taking them, or their A1C level is way up over 8, and you're saying, well, there's no way we're going to be able to treat this and have good results if we can't manage this other piece. But the provider network needs to be talking and communicating with each other. How do you think we're going to be able to overcome that hurdle?
Well, it really starts with having EMRs that talk and
Hmm.
communicate. I mean, there's a lot of interface that goes on with IT. Somebody needs to hear the message and see the value in what we're trying to advocate here. So, my EMR that I use currently has an interface from like 600 different systems. We don't have one national dental healthcare um, system, EMR, that they all talk to each other. But I have worked in an organization that actually had a dental clinic that we were able to refer patients to that could see it. So it's done. It's been done. It's little pockets. You have to find them, but it's usually the high risk population. But some of it is just seeing, like, I would expect a cardiologist to send me a visit note, a consult note. It really is just as simple as that, saying, okay, can you fax the PCP this visit note from today?
Right.
And vice versa, when you have a patient coming in, calling and requesting their last office visit note, a lot of meat and potatoes come in one, like just their visit clinic note, because a lot of doctors document including their whole past medical history. So sometimes there's stuff that we don't see as really important, like a mother history of diabetes when the patient is healthy weight, active, where we wouldn't see it, but you guys do. Like, it's more just you're waiting to catch something, and we're doing increased screening. But again, the guidelines change every day. They change for colon cancer screening, they change for breast cancer screening. And then there's those anomalies that kind of lie outside, the outliers, that we should be doing it a little bit earlier because the time that we're doing it at the date or the age that they're recommended, patients are already really sick. And a lot of that has to do with just their overall health. But some of it is their diet. You could have a 35-year-old in your clinic coming in for a routine cleaning, and their son just got diagnosed with type 1 diabetes, or their 15-year-old that just got diagnosed with type 2 diabetes, because that's happening at a higher rate because of obesity levels and so forth. You could do, if we train the hygienist at chairside to do point of care test A1C levels,
Right.
which are very easy. It's no different than a glucose check, and you get the results within 10 minutes.
Yeah.
You may actually save that person from years down the road of challenges if you screen them at 35, which we may not actually do in the primary care realm because they don't fit the mold. But you see the kid and you just got this information from the patient because you're doing a med reconciliation. All of a sudden the 15-year-old is on insulin or whatnot.
Yeah.
That puts a red flag it, because it's more like players in the field. We all play our part, but it's when you come together and really can make an impact on a patient. You may see an A1C level of 6.6. No, that's not like super high, but it's definitely pre-diabetes level, where instead of saying, oh, you're fine, we're going to clean your teeth, you're good to go, you could use that opportunity to tell the patient, we recommend you get a hold of your primary care doctor because this is what we found today. And I've had doctors like, why are they doing that? Like, why would they do that? It's like, why
Yeah.
wouldn't they do that? Like, like
Yes.
we have to flip the script. Like, I had in one of my offices graduate, actually doctorate level nurse practitioner students. And this is what actually prompted this whole project at the beginning, because I just had the conversation with you. And then I turned around the next day and had that conversation with him. And I said, would you ever, do you talk to your patients when you're doing, because this guy was in his final year, final semester, and then being let out into the world to now kind of be taking care of patients. And like, how often does this cross your mind to do this for a patient? How often do you screen for oral health? And he's like, never. I would never have thought to do that. I said, okay, how about I give you these statistics and now tell me how you feel about it? And he goes, he never would have connected the dots. But one conversation is all it takes. This conversation that we're having, and another provider actually saying, it makes sense. Like, when you think about it strategically, you're like, oh, okay, I can see the importance of why I should be having that. You need to see your endocrinologist, you need to see your dentist, you need to see your podiatrist. It goes along with it when you're dealing with a diabetic patient. But
yeah, and we're all if we look at it like we're all filters trying to accomplish the same goal, right? We do blood pressure screenings on all of our patients. I just put out a podcast about diabetes. There are dental offices that are doing A1Cs, and to me, there are some patients that they get to the dentist, but they're not sick, so they don't go for those routine physicals. So we can help kind of manage that. And then there's patients who go to the doctor but don't go to the dentist because they don't have a toothache. So it's kind
right.
of the same thing.
And for it's cost prohibitive, but medical care is also cost prohibitive for patients. So you have to kind of take that under consideration when you're, telling a patient you really should see your dentist 4 times a year or your hygienist 4 times a year for cleanings. And they're like, well, my insurance only pays for 1 or 2 okay, it's the price we pay, right? They're going to get it from you. You have to pay the cost at some point, whether it's $100 twice a year for a cleaning or the $160 once a month for insulin because your diabetes isn't being managed. Like you're going to pay the price somewhere is you're going to either pay it for healthy food, you're going to pay it for a gym membership, or you're going to be paying it for medication to manage those chronic diseases, and very expensive to keep yourself healthy, right?
It is expensive. Well, and it all comes down to that collaborative effort from all the different providers, because we know that the preventive services are definitely more cost effective than
Yeah.
the other side when we're trying to play catch up or rebuild, repair, restore.
I think the average, the statistic is for every dollar of prevention saves $10 of healthcare treatment.
Yeah.
So, that's your return on investment is 90% of
Yeah.
just going in and
So
seeing your doctor for your annual wellness visit, seeing your doctor for your annual physical. And sometimes I know people like, oh, I don't feel sick. But personally, I'll share a personal situation that just happened. I don't feel sick. I'm healthy. I don't have any chronic issues, but I went in for my physical because I see my doctor every September, and she found a lump on my throat. It turned out to be nothing, but wasn't having any issues at all. And now I'm going in for routine screening. And so much happens behind the scenes that patients don't see the value added in those preventative exams, but there's so much is caught in those, whether it's a hypertension episode, if it's an anxiety and depression issue, or if it's something like that she's like, oh, did you notice this lump? Because they do breast cancer screening, they do thyroid cancer screening, they do colon cancer screening. And again, you have to get in there, you have to get in front of your provider because they're the ones that are going to be able to identify those.
after doing your capstone, what would you like to see if you could fast forward 5 years down the road? Just 5. I'm just
Just
thinking 5.
5.
Just 5 years down the road, what would you like to see as like some real grassroots changes?
I would love to see legislation in this state really get behind a collaborative care network in this state, because it's a small state and it's totally doable. It's one, the funding has to be there. We have to, providers at the primary care level cannot bill for mouth pain. We can't, and that needs to change. Like, why? The patients call us because they can't get into a dentist or they don't have a routine dentist. We can give antibiotics, but that's not really fixing the problem. But some of it comes down to funding. So I think
Can you have a
improvements. I would love a hygienist on staff.
I think it's the perfect
I
spot
would love it. Having the clinical space that can accommodate both. There are community clinics like there's one in Rochester, I can't think of the name of it, but it has both, where a provider is seeing a patient and then they literally schedule with the dentist before the patient walks out the door, but it's a family health center. So, but it needs to happen in the private sector, it needs to happen in the bigger organizations, and it's possible. It really is possible, but if the reimbursement was different, And we were able to bill for oral health screenings in the primary care realm, and vice versa. Are you getting reimbursed for a diabetes screening? That has
Right.
to work too. That has to happen. I mean, I know it's like, I think less than $25 for an A1C test but again, who foots the bill? Because if the patient ends up having to pay it, they're gonna push back a little bit, I think, because they're already paying the price with huge premiums, really high deductibles, and it can't filter down to them. It has to be at a higher level because, ultimately, if we don't catch it early, these patients are going to end up on disability and on Medicare and on Medicaid programs, and the treatment and the disease management is astronomical. The cost, it's really a public health crisis
Yeah.
that we're trying to avoid. It's like stopping a freight train at the first station instead of mid travel,
Yeah. I've seen the statistics, and the future for diabetes alone looks pretty glum. But I have to say, when I hear you talk about just your advocating for oral health as like a focus, as part of the assessment process with all of your patients, to me, it just makes perfect sense to go ahead and stick that professional, stick that hygienist in the nursing home, in the health centers, in the schools, in the primary care office, in the rehab centers, like, because
yeah.
if nothing else, they're doing education, they're doing assessments, they're doing oral health screenings, they're doing nutritional assessments, they're helping patients connect the dots between their whatever illness or chronic disease or prevention mechanisms that they're there for, whatever treatment they are in your office for. You have that person who fills that role, who can meet that need right where the patient is and help be the go-between to connect the dots between these two services.
I mean, I think some of it is, me as a nurse can tell a patient you need to do XYZ, but it really comes, if it comes from the doctor, some of our patients are old school and the doctor's word is gospel, and they're, I think, more likely to follow if the doctor is the one making that suggestion saying, hey, but it's not just saying, hey, I want you to go to the dentist and get your cleaning done. It's really getting down to the why, because people, if they can understand the why behind why you're asking them to do something, I think they're more apt to do it. They're more apt to get buy-in. It's the provider saying, here, hey, John, your A1C is 10. We've tried this, and this, nothing's working, but I noticed, your oral health isn't great. Do you go to the dentist? Do you tell me what your routine is at home? And if it's not, I don't floss, I don't brush, sometimes it's switching from a regular toothbrush to a better electric toothbrush. You can sometimes get them on that, but they need to understand the why. Like, you're going to lose your teeth, which is going to affect your diet, which, you have better buy-in when patients understand that, how it's going to affect them, sometimes short term, because short term it's like, oh, my tooth hurts, but long term is, I'm going to be in dentures by the time I'm 65, which happens, and it happens at a higher rate, I think, in this country than many other countries, but some of it is just the standard American diet, which, if you look at the
Mhm.
obesity rates in the 70s and you look at them today, it's a
We have some work
compounding.
to do. Yeah,
Yeah, we have a lot of work to do. A lot
we
of
have a
that
lot of work
started
to do.
increasing in the 90s with, corn and how that's used. But
Yeah. I always love to hear what you're doing.
oh, I'm
I
doing
was
crazy things. We're changing the world one day at a time.
one
It,
patient at a time, one patient at a time.
one patient. I mean, honestly, it comes down to having a positive impact, and that's what we're trying to do. If you can get through to one patient every single day and one provider. So I'm trying at the provider level, and I had this conversation with one of my doctors, and she's amazing and her patients love her. And when I asked her, she goes, I do. And I said, okay, well, let's start asking these 6 questions. And she legitimately whipped out her computer and made up a smart phrase, and now that's part of every assessment that she does. That's the change. That's where you're going to see the change, because she's impacting every single patient. And now it's a routine questionnaire that she gives every single patient. That is going to change. That's going to if I were to say, okay, my wish list is if every electronic medical record added these 6 questions to screen for patients, what's your sugar intake, like sugary sodas, what's your family history, what's your, how often do you see the dentist? You could help that provider trigger the conversation to getting them to the dental care that they might be missing. Now, some patients are like, no, I go every 6 months. I have a cleaning. I floss every day. My dentist loves me. My hygienist is great. Those aren't the 42% that we're trying to focus on. It's the 58% that we really need to get in front of a health professional that knows that that's their specialty area. That's what we're trying to do.
Yeah.
So.
Well, I love what you're doing. I think you're right. If you can go to the provider level, you're going to make a bigger impact before you're tired.
Yeah, I can only talk to one patient at a time unless I do a seminar, but
Yes.
I
This is
mean,
why I go with students, right? I want every student that hears my voice to know that they can create value in what they're
yeah.
doing and that they can make a difference in some of these patients that really struggle with some pretty significant disease.
Yeah, well, that's why I had it was a doctoral student that I grabbed his ear because he's starting his career. But you change that perspective in one conversation, and it's just like a conversation and I are having now. And it did not take a lot of convincing to change his mind. And he's like, you know what? You bring some valid points. I never even thought of that perspective and why it's important. And yeah, I'll do that now. And these are the providers that are sitting on panels for hospitals, and they're sitting on committees that are really changing and forming how our healthcare system delivers care to patients. Those are the people that you need to get in front of and kind of get your hooks into and have them see the light a little bit, and it doesn't take long because it makes sense. So if something makes sense, the thought is, well, why haven't we always done that? And I'm like, I don't
Good.
know, but we should do it now. We can't go back, but we can start today. And it's simple little things that just asking the questions. People are usually very forthcoming if you ask the questions.
Yeah. I love it, Bam. I love that I mean, I love dental, right? So when I have you talking back to me about the need, obviously it warms my heart, but I love that you're taking on the challenge because it's a challenge
Yeah.
that really needs to be met. And I think you're doing a great job doing it.
Yeah. Well, my focus is really diabetes care and management. Every single person has a diabetic in their family or that they're close to. So this really affects everybody. And that's why I'm passionate about it. And it just happens that I drank the Kool-Aid and was very easy to convince that this makes sense. I can see the value added in this patient's life and care by doing these simple things. And they're not hard things it doesn't even need to take 5 years to get this integrated model in place. We could do it in 5 months if we could get the knowledge and the awareness. It's really awareness out the door that preventative medicine isn't reactionary medicine, and we're going to cut down on emergency room visits. It's going to save money. We're going to cut down on chronic disease management, which is going to save money, and it's going to cut down on medications, which is going to save money that it's used to take care of these people. And ultimately, we're just trying to create a system that is going to still be present when our kids get to the age where they need the help. Because if we don't save money now, that system is going to be broke. It's already going broke. And I've been in healthcare for 30 years, and I've heard that every single, how many times, I don't know, millions of times, like Medicare is going to have no money. And it really comes down to minimizing waste, minimizing money, saving patients money. And that's a value-based care model. That is bringing value added to the patient, getting them the best care, the most appropriate care for them, and having better positive clinical outcomes at the end. And that's what I think you're going to see a shift, because that fee for service model, the drill and fill mentality of dentists, really needs to change. It needs to change in the medical field. It needs to change in the dental field. And again, a dollar of prevention saves $10 at the end, but people don't, we all need to see the vision of it's definitely possible. It should have already been in place, but because the system being the way it is, we're all functioning in silos, and that needs to, somebody has to just say, but why? Like, but why do we do it this way? Like, just because we've always done it, I hate the term like, well, we've always done it this way, because that is the biggest hindrance to change. And nobody likes change, but I love change.
Yes, I know you do. I
We're
do
trying to
too.
change the world. Um,
One tooth at a time.
one tooth, one blood pressure, one patient. But again, it all comes down to cost savings and life savings. If you save the patient money at the end because you keep them healthier longer, diabetes is devastating to some patients. I've had some that end up on dialysis and they lose toes and feet and legs, and even our family members have been struggled with
Yeah.
that. And it can be a catastrophic disease, or it can be something that is managed. But what I see now is a lot more kids being diagnosed. And we've talked about this too, diabetes management has come so far since I've been a nurse. When I was a nurse, there were like two standard insulins. I'm dating myself. I'm such a dinosaur. There was NPH and regular, and that's it. But look at where we are now. We have kids on CGMs that get notifications. The parents get notifications on their cell phone that their kid's running high or low. They have insulin pumps that they can just literally put in a program and like hit send, and it delivers a bolus dose of insulin. Those things were not thought of 30 years ago when I started in healthcare. It was like, a pipe dream, but we're managing diabetes better, but there's still work to be done. And I think this is just like getting us to the goalpost of where we want to be. And diabetics are living their best life now. They're more active than they ever have been with the technology that has come with it. So,
Well, and that's what I want to say from a provider standpoint. When you're treating patients and you're able to focus more on prevention and good outcomes, it just feels better. The burnout rates go down, the
yeah,
joy, like the reason why you
the joy of
became.
medicine comes
Yeah,
back.
absolutely.
Well, those sick visits, one, are difficult to get in front of your own providers. So it's a lot of band-aid medicine going on. The rise of convenient MD or urgent care centers is rampant, especially in our area. I see it. I think I have like 6 that I pass between in the city here. But we've lost the focus that there has to be one driver of the ship, because when you just continually use urgent care centers, things get missed.
Yeah,
Sadly,
yeah.
you're there for a sore throat, they'll scan you for your sore throat. They don't, they treat you with antibiotics, and then the backlash is when you have an adverse reaction to that antibiotic, or you have underlying eczema that never came to light, but you were treated for a staph infection, and 6 months later you have a rash that you can't get rid of. There's nobody overseeing all of it, and that's where primary care comes in. So
Oh, there's
yeah,
work to be done. There's work to be
there's
done.
there's lots of work to be done, and we're just getting started. So good things are coming. I think we can get there. We'll get there. And I'll be so excited when I'm like, okay, this is an integrated model. I'll be the one cutting the ribbon at that place. So.
Love that. Love that. Well, that's a really good place to stop recording, Bambi. After listening to the content of this episode, I just want you to do a little bit of reflection. I know that your faculty has you focus so much on knowledge base and education and really motivational interviewing, understanding how our patients make changes in their behaviors. I hope that after listening to this episode, you can see how significant that role is in what you do. Taking little tiny incremental steps at changing the behaviors of each patient you work with and increasing their knowledge and awareness, I think goes a lot further than we really realize when we're working with our patients. It can sometimes become daunting when we have a patient in our chair and we see them again and again and again, and they're not making progress in the right direction. Please consider that you are making changes for that patient, but there might be components that you're unaware of. I'm hoping that this episode helps you see that there's people on the other side with that patient, working with that patient, who are probably feeling the very same way. And this is where dental and medical integration is essential. It's necessary. It's more rare than we'd like to think, but I know we can make progress and move in the direction to really serve our patients in a comprehensive way by building these partnerships between our dental providers and our medical providers. So when you're working with your faculty and we're focused on teaching you about motivational interviewing, about how to change behaviors, the elements of good instruction, and really meeting our patient where they're at and taking those little bite-sized small steps, moving them down the path to changing even just one behavior, you are making progress. And I know it doesn't feel that way. So here I am, this little voice to remind you that those little changes make a difference. And by connecting with those medical providers to collaborate and build those partnerships, you're going to make even more meaningful changes. And those medical providers are going to be relying on the dental hygienist to help support their efforts and build that awareness around the entire healthcare system. I challenge you to consider not only the options, the role, but the possibilities. I would invite you to send me any questions that you need answered. Questions come up when you listen to this podcast. I have a link in the show notes, and I'd be happy to answer any questions that you have. Also, I would appreciate a review if you have time to leave one. Thank you so much.